This will be the last video that we do on the Lisfranc injury to the foot. This is going to be just a quick series of shots showing the different kind of exercises that the therapy group at Momentum Physical Therapy had me do in getting back to walking. I hope that you enjoy it and have a better idea of what to expect if you have to go through this kind of an injury. Take care.
So now we're working on increasing right ankle dorsiflexion. So we're getting her to internally rotate her foot so she'll get more calcaneal eversion so that her mid-tarsals can adapt to the ground or the environment it's in. Alright, we're having her do a forward lunge onto her right ankle. Then we're getting her to internally rotate her leg, which unlocks her metatarsal so it can adapt to the floor. So now we're working on a hip flexor stretch for the right leg. Here she's been in a boot and she's been using a scooter for a long time, and we haven't had the proper hip extension to help her with walking. So now we're working on shifting her weight forward and backwards, and we're also going to go side to side. We're also going to do a little bit of a rotational weight shift. So we're preparing that ankle to receive load in all three planes of motion to prepare her to walk. So now we're going to work on step throughs, where I'm going to have her load that left foot and kind of go through a normal walking motion, forward and backwards. So it's going to prepare her to walk normally when she's ready.
Here's a shot of me on May 5th, and it's the first day that I've been able to get off the scooter and apply a weight onto the boot with the help of the crutch. I had a lot of sessions like this where they really worked the foot and the ankle around. This is Friday, May 8th, the very first day I was able to walk in the boot without the use of a crutch.
So we're doing some soft tissue massage to her right calf. She hasn't been getting the right dorsiflexion on her right foot because she's been in the boot. So this muscle here got really, really tight. So now we're going to loosen it up. Kristen's now doing TRX chest press to work again on core, arm muscles, and also get the dorsiflexion stretched for her ankle. Alright, Kristen's doing a TRX row, activate her core, also get a little bit of a plantar flexion stretch on her right ankle.
Yes, even got to do some squats.
Now this is going to be a progression from her sitting heel raises. Now she's doing standing heel raises to work on calf strength. She is going to use her shin to perform soft tissue massage for her calf to loosen up the muscle to increase ankle and foot mobility.
I'm using the rocker board front to back, then sideways. This is the worst exercise I had to deal with, the step down. Boy, did that hurt. This is a machine made by the True Corporation. It's called the True Stretch. Really awesome. This was pretty interesting and was very helpful. Well, the first time I did this, I really was not able to maintain my balance very well. Very interesting. And as I did it week after week, it started to really pay off. This little exercise, touch your nose in the wall, keep your legs straight, helps develop calf muscle strength. I get to see my doctor at the end of June, and we're going to schedule a time in July to have the 2 titanium screws removed out of the foot. It's going to be a quick ordeal. I probably will not put anything up on that. It's a 2-week process for recovery. I go in for surgery. They take the screws out. It's about an hour to 2-hour ordeal. They put me into a surgical booty. Somebody drives me home that day. Then I wear the boot, the original boot that I had on from surgery, for a couple of weeks, and then I should be good to go. I have to say that the toughest part of this entire ordeal, which started on February 27th with surgery, all the way up into the end of June here, has been the therapy. It's been more grueling, it takes its time, recovery isn't as fast as I thought it was going to be, but I really appreciate all the help and support everybody that has helped me with, and I hope that no one ever has to go through this. But if you do, I hope that the series of videos that I put up gives you a better explanation of what to think about that's going to be happening if you need this kind of surgery. I appreciate you taking the time to watch. I hope none of you have to do this. Thanks so much. Take care.